Hey guys, Dr. J, I Breathe Dentistry. We've been getting a lot of questions lately about implants. We've been doing a lot in the last couple of weeks, and I've noticed kind of a pattern among the questions you guys ask. So I'm gonna run through the most common implant questions I get. I'm gonna try to answer these quickly for you to get you a little more familiar with questions that either you should know the answers to, or you might wanna ask your dentist if I am not perchance the dentist that you guys are going to, for whatever reason that might be. First and foremost, does the implant hurt? I think that's the most common question when we talk about implants. It's sometimes hard for people to think about the procedure itself. It scares them. I'll say this, that most of the time, about 90% of the time, we're doing an implant at the same time that we're removing a tooth that's non-restorable. In that situation, when the tooth is already out, you're extremely numb for that procedure, and it is not painful to add the implant into that situation. Healing time actually improves some of those times because we actually have something filling in the socket now, but that procedure is not painful. Now, following the procedure for the next couple of days, usually there's some tenderness, there's definitely some soreness. No doubt about it, there's going to be some level of discomfort. Now, in my opinion, 1 being no discomfort, 10 being horrible discomfort, usually the average is probably somewhere around a 2 or 3. Majority of our patients will go back to work the next day, and they don't report a whole lot of changes to their life afterwards. So keep that in mind. I'll know in hopefully a couple of months when I get some implants here to replace some missing teeth that were taken out from me when I did braces. I'm going to be putting those back, and I'll document that to show you exactly what I thought of that, as well as the discomfort level. So we'll keep you updated there. How long is the recovery? Again, a couple of days. We need about 3 to 4 months for the implant to actually heal in the bone so the body can graft to it before we can restore it with usually a tooth on top of the implant component itself. But that being said, the recovery right after the procedure, a couple of days. Most of the time we do a lot of them on Wednesdays, Thursdays. Patients are right back to work on Monday with no biggie. Many of our patients, like I said, have gone back to work the very next day. So I'll hold out my personal opinion until I have it done for myself, but I would think it's going to be maybe a day, 2 at best, and most people are right back to where they were without much of a thought to it. Our implant is safe. Well, they're very safe. Obviously, the procedure needs to be safe, and that's what we use a 3D CBCT x-ray for, to determine where your anatomy is and the important things that we can't get close to. That being said, the implant procedure is very safe. When it comes to the grafting of the body, or will the body reject it? That's another common question. The body doesn't usually reject an implant for the sake of it being an implant. It's titanium. It's made out of the same FDA material that like knees and hips and things are made out of. So there's not much of a chance for it to just be rejected for the body saying, I don't like this. But that being said, very safe procedure. But again, we need to have the right equipment in order to know exactly where we're going. That's where a 3D x-ray, in my opinion, is a must to know that we are not going into somewhere that we shouldn't be going. So another good answer hopefully for you. What are the dangers of having an implant? Well, I guess the most common side effect of an implant, if you want to call it a side effect, is infection. There's often an infection that can come up after a couple of days. Usually we use an antibiotic at the same time to prescribe that the day of the implant placement to make sure that we don't get an infection. Dangers, aside from hitting things again anatomically that we shouldn't be hitting, such as nerves or other things that we know we won't do with the 3D x-ray. We're able to trace those things, that important part of our anatomy that we got to stay away from. It's essential, but we've never had here in my office, or myself personally, never had anything go wrong per se with an implant that has caused any kind of negative outcome that wasn't reversible, at least. So not very dangerous. What are implants made out of? Well, titanium, again, most of them all are made of titanium. There's some newer ones that are coming on the market that are made out of a really dense porcelain called zirconia. A lot of mixed opinions on that. Definitely not something that's being used in most places, and probably won't be for a while, but it is titanium. They're made out of titanium. Usually the connection pieces that hold on the tooth are normally made out of titanium as well. If not, they are made usually with a zirconia, that hard dense porcelain, and of course the tooth is made out of porcelain that usually goes on top. How long do implants usually last? Well, a lot of that depends really on the patient. There is a lot that we as clinicians, of course, have to determine, and that is what is the best implant to use for your particular location, for the tooth that we're replacing. What's the size, the diameter, the length? Those things do make a difference, but more than anything, the longevity of an implant will come down to how well you take care of that implant. If it's cleaned, if it's cared for at home, does a hygienist get to clean around it after it's being placed? I think the most common thing that I see is implants that were just neglected after they were put in, as if they were any other tooth, but the same process occurs. Inflammation can occur around it from the bacteria that hangs around the implant. Bone is then lost as a result of the body trying to fight that, and we lose the implant over time. So that's the main reason that we see them are lost. But I would say, to answer that question specifically, how long do they last? Well, I'm hoping 30, 40 years, at least 20, but my goal every time is to see it last a lifetime. Again, unfortunately, it doesn't really come down to me. Majority of the time, it's in the hands of the person who got the implant themselves. What about a bridge versus an implant? Well, bridges have been used for a long time. They obviously span from one tooth to another tooth where they covered in the area that was missing a space or had a space where a missing tooth was done. And I'll say this, I don't like bridges all that much. We use them in the right scenarios when it's needed. But overall, if an implant can replace a missing tooth and you don't have to involve any other teeth around it to solve that problem, you're always better. The number one problem with bridges is that one of the two teeth that are connected to the bridge itself, that's connected to the space, I should say, one of these will often get decay underneath them because it's very hard to clean. If that happens, you now have three spaces, two teeth and a space in between it if it's just a 3-unit bridge. That has now got a problem. And so one tooth can have an issue, and now we have to think about what's going to happen for 3 spaces, 3 different areas where the teeth should be. And so it kind of becomes a little bit hairy, and that's why an implant is a single situation. If it has a problem, it's a single problem and doesn't involve any other teeth. So I'm always going to recommend an implant unless a bridge is our only other option from lack of bone or some support, things like that, or if there's already been a bridge in place, et cetera, et cetera. So are there differences between implants? Yeah, there are. I mean, there's 1,000 different brands, it seems like now. I would say this, that if you're looking to go to another dentist for an implant, or you come here, it's perfectly fine to ask what kind of implant it is, meaning what kind of brand. There are a lot of knockoff brands, there are a lot of different styles. Majority of implants, I'll say, do work. There's not a lot of them that I would say don't take or have an issue. But that being said, I think it's important to have a pretty name brand implant. And the reason I would say that is the components will be easier to find later on down the road. So if 20 years from now something changes with your implant crown and it needs to be restored again, it's not going to be some weird implant system that no one can find the parts for or discontinued. It's kind of like buying maybe a car that's really hard to find and you can't find the parts for it. I see that often with implants. And so you want to find an implant that you can quickly do a Google search for, find the website, seems like a very legit website, then you're likely going to have at least some instinct that this is a name brand implant. It's going to be easy to find components. That's just my opinion. Some may argue with that, but that would be my concern. So feel free to ask your dentist what kind of implant and what brand it is. That usually is a fair question to me to ask. How many appointments does it take to get an implant? Well, usually 1. In most cases, again, I'm doing extractions and an implant at the same time, but there are instances in which you need to take out a tooth, graft the area with some bone particulate and let that heal so that 4 months later you can come back in and place an implant into a solid foundation. However, like I said, 90% of the time I'm taking out a tooth that's non-restorable, I'm placing the implant at the same time, we let it all heal at once, and then 4 months later we are able to come in and actually restore the tooth onto the top of that implant after the body is grafted and attached to it. Now, there are circumstances in which that doesn't go as planned, but that's somewhat rare. So to answer the question, how many appointments does it take? Well, ideally, 1 to place the implant when we extract the tooth, 2 to uncover the implant and let it heal, 3 to take an impression, and 4 to restore that tooth. So up to 4 appointments, sometimes even 3, depending on the state of the tissue around the area where we're doing the implant. So 3 or 4, but all very easy appointments for the most part. And how much should I pay for an implant? You know, there's a lot of different places that are advertising, cost differences. There are usually 3 components that we have to remember: the implant itself, the abutment that connects to the implant, and that's the piece that goes in between the tooth part, the crown, and the implant itself. We don't connect the tooth part straight to the implant. We use that middleman called the abutment. With those 3 components, usually the average price range between implants is somewhere around maybe $2,000 to $3,000 or $2,500 to $3,500, where you see advertisements for maybe an implant for $1,000. The question is, what's the abutment going to cost? What's the crown going to cost? Most of the time, it's just advertising certain specific pieces and not kind of the whole restoration. If it is $1,000 to $2,000 for everything included, my question would be, what kind of implant is it? There might be some questions, something there that just doesn't quite add up to me as a doctor. I know that what the costs are, and to me, having it less than $2,500 to $3,000 would be somewhat concerning to me as to why it got that cheap. But again, that's just my opinion. So you get what you pay for, especially in health. I don't think that it's a smart move to try to start chincing money when it comes to something that should hopefully last your lifetime. But that's about the average rate that I see going right now. It's around $2,000 to $3,000, sometimes $2,500 to $3,500 is kind of the going rate. I'm interested in getting implants, or maybe you need an implant and you're asking, okay, what do I do now? Well, if again, it's not us, call your general dentist office, find out if they do them. There are more general dentists now placing implants than surgeons, but that being said, there's still a lot of periodontists and oral surgeons placing a lot of them, and they always will, and that's awesome. And there's a lot of general dentists that are now very experienced in this and can do that for you as well, like we are here at Breathe Modern Dentistry. So if you have a question about getting a consultation, I'd call up your doctor, call us up if you have questions questions here and schedule an appointment. We'll do a consultation. We'll look around at the support that you have. We'll look around at the rest of the teeth, and we'll talk about solutions that fit you specifically. That way we can get you some costs so you're always ahead of the game. You're always aware of what you might pay. And some people do ask, is insurance going to help with this? And I always say, well, your dental benefits might help. It's just really a question of what kind of benefits do you have? What specifically does your plan state about implants for you? Because they all do vary. Some happily cover a portion of it and chip in for that. Other insurances say, we're not ready to do anything for this. So you just kind of have to know your plan, and we'll be happy to answer those questions and check your plan out. I hope that answers most of the questions you might have about implants. Those are probably the most common questions I've been getting. So I just wanted to throw those out there since we've been doing, again, so many of them and been asked that a lot. Figured there might be more people that want to know those answers. Hope you all are having a great day. Enjoy fall. I'll see you soon.